First, though, this is a very special moment. It's a special moment not because we're at Rambam or because of the summit, but because Jeff Drazen and I are in the same room together. Like biting your nails or acting with animals or children, Jeff and I never appear in public together. It's not that we knowingly avoid one another, do we, Jeff? I don't think so. I don't think so. But strangely, over the years, our paths have very rarely crossed. So before I say some things about Rambam and the summit, I do want to say a few words about Jeff and the New England Journal. Sorry, Jeff. The New England Journal of Medicine is a great journal, and Jeff and his team, and Julie Inglefinger is here, have made it even greater. And it's important for me to say that because it's never been more important to have a strong New England Journal of Medicine. I can't recall a president of the United States who has proposed such draconian cuts to the National Institutes of Health's budget. I can't recall a president of the United States who has vacillated so much about the wealth of evidence on climate science, and I can't recall a president of the United States who's proposed cuts to America's life-giving foreign aid programs. Science is one of humankind's greatest creations and endeavors, and medical science, the science of alleviating humanity's many sufferings, the science of realizing humanity's many possibilities, is one of the greatest creations and endeavors of all. Jeff, let me commend you and your team at the New England Journal of Medicine on behalf of the Lancet for defending, protecting, and advancing medical science and at an extraordinary moment in America's history. You are a critical force of resistance in this strange age of anti-science. But it is an extraordinary age in other ways too. Never before have we as a global community had so much knowledge, and yet never before have we seemed paralyzed in our ability to use that knowledge. Never before have we been so interdependent as peoples one with another, and yet never before have we feared one another so much. Never before have we had the tools to communicate in real time as we do now. And yet never before has it seemed that we are unable to communicate with one another. What do we make of these paradoxes? I believe there are some clues to be found in the work we have recently published on the health of Israel, led by colleagues here at Rambam, especially Professors Bayar, Skoreski, and Azam. Every country is unique, but Israel has a right to claim to be more unique than most. While my country and many countries are today fearful of immigration, you have embraced it, and you've built your national success on it. While many countries deliberately choose to forget the lessons of history, you work hard and successfully to make sure that history can never repeat itself. While many political leaders choose words that divide their societies, often humiliating certain groups within their societies, your president, and we had first-hand knowledge of that when we went to visit him and heard him speak, your president chooses words that unite the communities of Israel as one people and look forward to full equality between those communities. But what do these special qualities of Israel mean for medicine and science? Well, you've heard a little bit of the story. Amid the controversy of a tragic conflict in 2014, Carl and Rafi, Professor Skoreski and Professor Bayar, wrote to me to invite me to visit Israel, to visit Rambam, in order to meet Israeli health professionals and to learn firsthand about health and healthcare in this great country. It was a courageous and it was a generous invitation. Thanks to Carl and to Rafi, I began a new journey of learning that culminated in the series of 12 articles you've heard about. We launched this a few weeks ago in Tel Aviv, in Haifa, in Nazareth, in Beersheba, and finally before your president in Jerusalem. It was a big first for us. Never have we had podcasts in Hebrew and Arabic, which I can tell you for colleagues who speak neither language was a challenge to put together. But I want to say a few words about being an editor, because being an editor, the role of an editor is to reveal the genius of the author, to be their advocate, to be their supporter, and to be their friend. And the authors of the Health of Israel series, all 47 of them, set out the tremendous achievements of Israeli healthcare, and I and my team at the Lancet were proud to be the midwives of their story. Building lives, coming of age as a nation, bridging the religious and the secular, offering helping hands across war and borders, creating a nation of digital innovation, and going beyond health, investing in health for wealth, reconceiving the idea of security to one of human security, and using the idea of health to renew the social contract among the Israeli people and between Israel and its closest neighbors. And they explored the reasons in their papers for that success, reasons that other nations can learn from. Your political commitment to universal health coverage, world-class medical schools, internationally competitive research, an extraordinary culture of innovation, and a diverse, pluralistic society. The result that Israel is 25th in the World League table in quality of care, as I said this morning, for those of you who were here, ahead of the United Kingdom, ahead of the United States. And Rambam is at the center of that success. I'm very fortunate that Rambam was my introduction to Israeli medicine. Each time I come, I witness astonishing pace of progress. New buildings, new state-of-the-art facilities in both care and research, and unbridled optimism about the future and what can be achieved. Rambam exemplifies the success of Israeli medicine and healthcare, not only in terms of concrete, glass, and steel, but even more importantly, in terms of its values. There is an ethic of care at Rambam that is inspiring to see and to feel. It's an ethic that enhances and embraces all people, irrespective of their religion, their origin, or their geography. It was this ethic that led Carl and Rafi to extend their hand of friendship to me and to the Lancet, to build an enduring collaboration, to believe that we shared more than anything that might possibly divide us. And I have to, standing here, say a particular word about Carl. Carl is a man of science, and he is a man of faith. He's a man who is a role model as a humane physician. He's a man whose skills were forged in the very best of Canadian and American medicine. But that wasn't enough. He was a man who, with his family, sought to make an even deeper contribution to human health and to human healing. He came to Israel, and with an extraordinary team, here at Rambam, led by Professor Bayar, helped to build this institution into a truly global center of excellence, one that unites communities together. And I say this from personal testimonies that I've heard from Carl's colleagues. He became a mentor to a new generation of young Israeli doctors. And Carl, you became my mentor too, and I thank you for that. Instead of boycotts, instead of condemnation, instead of division, we sought partnership. In nothing less than a joint search together for the truth about health in Israel and amongst its immediate neighbors. A joint search, I would say, for a common humanity. From a moment of frightening conflict came an optimistic vision of unity and understanding and compassion. And through this exchange, I see the opportunity for amplifying the values of Israel and the hopes for Israel in the region and indeed globally. Values of dignity, respect, and decency. Values that too often, I'm afraid, the world does not see when it reads or hears about Israel in the news. This idea of decency is important. It is the central theme of Israeli philosophers Avishai Margolit's greatest work, The Decent Society. A decent society is one that safeguards human dignity. A decent society is one that has no second-class citizens. A decent society is intolerant of inequality. And health and health care are the litmus tests of that decent society. And Rambam is at the forefront of protecting and advancing these ideas and values of decency. Now let me turn very briefly to our troubled world, because I can't stand here before you without making reference to that, and to the part that Israel can play in healing some of the world's wounds. As we have seen, many European cities, indeed Europe as home to the Enlightenment, is passing through a period of counter-enlightenment. Nations distrustful of globalization are turning inwards. Democracy is in recession. Global peace is diminishing. How are we to respond? Today at 1 o'clock, your time, 11 o'clock London time, my country held a 1-minute silence for 7 victims of the latest terrorist attack that's taken place in the United Kingdom. 3 attacks in the past 3 months. Now, the temptation when faced with terrorism will be to rush to judgment. The temptation will be to use words and to implement policies that will collectively punish entire groups of citizens. The temptation will be to roll back long fought for freedoms and to accentuate suspicion and blame. Some say that there is no such thing as a global community, that there's only a global stage, a global arena, they say, on which nations must compete against one another for their own advantage. I reject this Manichaean zero-sum vision of the world. No country can be an island any longer. The threats that we face together, from the risks of lethal pandemics to the realities of rising air pollution, from the epidemic of chronic disease around the world to climate change. These threats mean that the idea of a truly global community sharing a global identity is ever more important, indeed ever more urgent. Medical science, our discipline, and our collective health are important catalysts for creating and strengthening that idea of a global community and a global identity. And Israel, has an important part to play in that absolutely necessary global conversation. Israeli science, Israeli medicine and public health, especially so. I want to see Israel engaging even more energetically with the world, not through others, but directly, sharing the lessons of its achievements, the solutions that it has devised to its existential threats, the solidarity that it has engendered, and nowhere more so than at Rambam amongst its communities. I'd like to conclude by emphasizing one opportunity above all. Writing, it's with great chagrin, I have to say, in the New England Journal of Medicine, many years ago, 30-odd plus years ago, Shimon Glick, a great man who is not with us this evening but was with us earlier today, he signaled a warning. And that warning was that as medicine progresses, there is a danger that the physician regresses. He wrote this: "The crisis of humane medicine is the result of the failure of secular democratic societies to inculcate moral and ethical values into their educational systems." Professor Glick was calling for nothing less than a remoralization of medicine. And he wrote that call in 1981, and yet we have yet to act on his call. But if only we did, we could grasp remarkable new opportunities to build trust and confidence among and between peoples, to write a vision for a new future for a people, a nation, and their relationships with other peoples and nations. Health and medical science can be strong bridges to peace, reconciliation, and justice. That is not only my view. It was the view of somebody very close to your hearts, Maimonides, who, in his Guide to the Perplexed, wrote about the relationship between the health of the body and the health of society. And he wrote this: "As for the well-being of the body," he wrote, "it comes about by the improvement of their ways of living with one another, in the governance of the city and the well-being of the states of all its people." Maimonides' point was simple as it was sharp. There can be no health without a healthy society. And the physician has a duty, a moral duty, to play a part in the delivery of both. The deep and the enduring partnerships that we have established together over the past 2.5 years with Rambam seek to realize that aspiration. And so I am exceptionally grateful and privileged to be here this evening to share your fellowship, your friendship, and this exceedingly generous award. Thank you so much.